So for people that have a hip issue, and let's say it's a degenerative issue such as arthritis, there's lots of reasons why you can have hip pain. But probably, at least in the age group of patients that I take care of, the most common reason that I'll see people with hip issues is arthritis. And the most common reason for you to have an arthritic condition is just run-of-the-mill wear and tear osteoarthritis. And so what does that look like for people? Generally that's, pain in their groin when they're walking. Usually it's relieved when they sit down. They'll have a hard time getting in and out of the car. They have a hard time lifting their leg up to put on their shoes. People that have these conditions, very commonly, I know it immediately when I meet them in the office because they have a slip-on shoe with them. They don't wear shoes that require lacing or tying because it hurts them to lift their leg to try to tie their shoes. So those are some of the things that are just, very typical kind of complaints for people with one of these arthritic conditions. Very often they'll experience stiffness or, the kind of complaints that drive them into the office finally to seek treatment. They'll wake up in the middle of the night because they roll over on their hip and they have terrible groin pain, or they describe kind of a searing, burning kind of pain in their hip joint when they're walking. And it can be very debilitating. Oftentimes it can even progress to the point where people start to lose motion at the hip. And they'll notice that they have a hard time getting up or out of a chair or trying to use the restroom, or just these basic functions of day-to-day life start to become really difficult because the mechanics of the hip start to get altered as the shape of the hip starts to get altered as it becomes worse and progresses. And then oftentimes we'll even see people where the hip will become so bad it'll start to make their back hurt. And so then it's sort of just this chain reaction of problems that can result from having an arthritic hip. Oftentimes those are people that they'll have usually checked with, say, their primary care doctor or their physical therapist or somebody like that. And some of these things will tip somebody off, and they'll say, oh, you might have an arthritic hip, you should probably go get an x-ray. Or sometimes we'll even see people who will come in with MRIs, and we take a look at this imaging and we talk with them about their complaints, and it's usually it's very common. It's a very kind of routine visit in the office for us to see people with these kinds of complaints.